Hi, I'm Jennifer Anderson, practice manager and founder and CEO of Optimal Health Advocates, an ancillary revenue generation company for medical practices and healthcare facilities. And today, I'm going to give you a quick overview of our exclusive in-office PCR lab program that will allow your practice to capture significant outside lab revenue and have a 1-hour turnaround time on a wide variety of tests from UTI and respiratory infections to nail fungus and wound care. I'll go over how our unique program is revolutionizing the way medical practices deliver quality patient care and increase monthly revenue by at least $30,000 per month with zero out-of-pocket capital expenditure for the practice. I'll show you how our program provides your practice with a complete turnkey operation that includes the testing device and supplies, dedicated on-site technician, pre-authorization and billing, and CLIA licensure. And lastly, I'll go over the simple steps on how to qualify your practice to take advantage of our joint venture opportunity. But first, let's go over a few basics. What is PCR testing? PCR, or polymerase chain reaction, is a molecular testing technique that is used to amplify trace amounts of DNA or RNA, essentially identifying the DNA of pathogens like bacteria, viruses, yeast, fungi, and protozoans, which are the organisms that are the cause of infection in different clinical scenarios. Some of you are already familiar with PCR testing technology since it's been around and available for clinicians for many years, going back as far as 1985, and your providers may already be mailing out samples to a third-party lab for testing. I can remember as far back as 1999 when the women's clinic I worked for was able to send out urine samples and get 24-hour PCR results for chlamydia and gonorrhea screenings. So what specialties can use PCR testing? Well, PCR testing is applicable in a variety of specialties, but our program is a great fit in specialties such as urology, OBGYN, primary care, family and internal medicine, ENT, wound care, urgent cares, podiatry, GI practices, and larger surgical groups who treat post-op infections. And we also have some hospitals. We have well over established 100 locations across the United States. There are currently testing panels for UTI, STI, and respiratory infections, including over 20 pathogens, anything from hand and foot and mouth to flu A and B to strep and the coronavirus, plus wound care and nail fungus panels. And in the next few months, we'll be adding panels for vaginitis and GI-related infections. So PCR testing has been around for quite some time. What is groundbreaking is being able to run these tests in office, which now gives you the clinical and operational advantages of getting test results for your patients in an hour, allowing you to treat an infection significantly faster than a traditional culture and avoid unnecessary treatment if no infection is identified. And because the test is identifying DNA and amplifying it, it's significantly more accurate at identifying more and fastidious pathogens that traditional cultures will miss because they're too small in quantity or don't easily grow in a petri dish outside the body. At the 2018 annual meeting for LUGPA, or Large Urology Group Practice Association, investigators reported on a study where urine samples were collected from 582 patients who were experiencing lower urinary tract symptoms and had indications of cystitis. Both a PCR test and a traditional culture will run in parallel. The PCR test detected 22 organisms, whereas the traditional culture only detected a maximum of 15. Now, our PCR test results also provide an antibiotic resistance readout for your providers, which will help the provider to avoid prescribing an antibiotic that the detected pathogen is already resistant to. Antibiotic overuse has led to antibiotic resistance and the creation of these superbugs. And this is a real global issue. And the treatment of UTIs is one of the primary contributors to this growing problem. Resistance in E. coli, for example, to one of the most widely used medicines for this medicine, for the treatment of urinary tract infections, fluoroquinolone antibiotics, is extremely widespread. There are countries in many parts of the world where this treatment is now ineffective in more than half the patients. The failure of treatment by the last resort of medicine for gonorrhea, third-generation cephalosporin antibiotics, has been confirmed in at least 10 first world countries like Australia, Canada, France, Great Britain. According to the CDC report released last November, antibiotic treatment Antibiotic-resistant bacteria and fungi cause more than 2.8 million infections and 35,000 deaths in the United States each year. In 2018, the World Health Organization identified antibiotic resistance as one of the biggest threats to global health. And the CDC has already started to mandate the Antibiotic Stewardship Program, as you can see here in the slide, in hospitals and long-term care facilities, and it will only be a matter of time before it's mandated in the outpatient clinical setting. So one of the nice things about the program we've created is that it will not only keep you compliant, but also proactive in the Antibiotic Stewardship Program, with monthly reports showing how your use of PCR testing reduces the use of antibiotics and will increase your facility health score. Now, there's a growing wealth of studies, too many to cover them all today, that show how the use of PCR testing technology in many specialties is reducing the overall cost of healthcare and improving patient outcomes, and helping providers to prescribe antibiotics more appropriately. But here you can just see the example of the impact of UTIs on the healthcare system. In a 2017 study, traditional cultures missed identifying infection up to 30% of women with UTI symptoms. Now, back in 1998, I just so happened to be one of the statistics of patients that was prescribed the standard protocol of Bactrim DS antibiotic after presenting with symptoms of a urinary tract infection that later ended up with me being in the ER with severe back pain and nausea and being admitted for a kidney infection. My symptoms came on very fast and in the evening and were eventually treated with antibiotics, IV antibiotics. Now, this is going back 20 years ago, but the initial treatment protocol for UTIs really hasn't changed significantly. At most practices today, you still have to wait 1 to 5 days to get culture or even PCR test results to confirm the pathogen and the accurate treatment, since they're being sent out for culture and testing. Had I been able to get a PCR test that first visit, thousands of dollars of expense and hours and hours of writhing pain could have been avoided. Instead of me being doubled over, throwing up in the ER bathroom, I could have been at home with my college roommates on a usual Thursday night watching the newest episode of Friends. But seriously, I was able to return home early that next morning. But what if it was your mother or grandmother, somebody who's immunocompromised or at higher risk for sepsis? The outcomes in these cases are usually much more deadly. Results of a large population-based study suggest that delaying or withholding antibiotics in elderly patients with urinary tract infections increases the risk of sepsis and death. The risk of bloodstream infection was more than 7 times greater in patients who did not receive antibiotics immediately after seeing the general practitioner for a UTI versus those who did, according to the results of a study based on primary care records and other data for nearly 160,000 patients aged 65 and older. Death rates and hospital admissions were significantly higher for these patients, according to the study published by the Imperial College of London. So it's pretty clear that early detection through PCR testing and appropriate treatment is one of the ways to avoid these life-threatening cases of sepsis. By integrating our in-office PCR program into your practice, you're going to get better clinical results, eliminate overprescription of antibiotics in your practice, and get faster results that allow for more accurate and timely treatment options and outcomes, thus improving your patient experience and reducing overall healthcare costs, and all with zero out-of-pocket capital expenditure for your practice. Now, with one testing unit at your practice, you can run up to 8 tests an hour. Now, most won't need to do that. Obviously, the patient load is probably not that high, but for a typical practice who runs about 8 tests a day, they can generate over $30,000 a month in bottom line revenue. So let's take a closer look at the financial side of this joint venture. Now, again, the complete turnkey system is designed to be completely effortless on your part. Our team gets your practice completely set up with a testing device, dedicated on-site technician, and CLIA licensed. Now, molecular testing does require a high complexity CLIA certificate, and we handle that complete setup and certification of your lab and maintain compliance ongoing. And one of the unique benefits to the program is that our billing team uses software to ensure that pre-authorization is obtained prior to any testing. So you can rest assured that there is no surprises for the patient or practice from a financial standpoint, and almost zero denials. So this pro forma example is for a practice that runs that minimum of 8 tests a day, or about 175 tests a month. After expenses for running the lab are covered, there's a 50-50 split of the revenue, and the practice monthly revenue is over $30,000, as you can see, $31,240. While there's no upfront cost to get started, there is a cost per test of $265 to run the lab and the test, which is invoiced to the practice only after the insurance has reimbursed for the service. One of the questions I've been asked about our program is how we handle the higher cost of PCR testing, since it is more than a traditional urine culture. Even with the clinical advantages of PCR testing technology, this can be an area of concern. However, the contractual relationship that the practice has with the billing company allows the practice to establish policies and procedures ahead of time to establish cash pay pricing that's appropriate for your patient population, and how your practice will handle patients with higher deductible plans, and any collection activities can be handled on a case-by-case basis. And all that's required in your office is a 6-foot long workspace, ideally in a 10 by 12 foot area. CLIA licensure and ongoing compliance is part of the program and does not require any upfront cost. So, how do you know if your practice qualifies for our program? First thing you're going to want to look at is patient volume. As I said before, program participation requires an estimated minimum of 8 tests per day per location. Some practices may have multiple locations in an area and not enough volume in any one location, so they can courier patient samples to the single lab location and are able to meet volume minimums. If you're already mailing out PCR tests, you may already know exactly how many tests you can do, unless you're going to be adding additional testing panels. Otherwise, best thing to do is check with your clinical staff on how many cultures are being sent out each day, and that will give you a good estimate. There are some instances where volume can be a little less than 8, as long as the practice's payer mix has a higher average reimbursement rate. There are some exceptions there. So the second thing is, if you meet that minimum volume, then you complete the practice pre-qualification application next. Now, each practice must be pre-qualified in this way prior to the program placement as having sufficient volume and payer mix. Our PCR billing experts will review your last 12 months of historical data for a specific set of ICD-10 codes and your unique provider and payer mix to make sure that the joint venture makes sense for both parties. It's a very simple qualification process, and it takes about 1 to 2 weeks to complete once you've submitted your practice pre-qualification application. So once you're approved, we'll send you a letter of approval and a customized practice pro forma that shows you exactly how much income is going to be going to your bottom line every month with our program. And at this point, you and your decision makers will be allowed to speak with some of our clients that are already benefiting from the program before moving forward with onboarding if you choose. And once you give us the thumbs up, we sign contracts and we have your lab up and running in about 30 days. So again, to get started, all you have to do is submit your practice pre-qualification form to your authorized account executive, or you can email and fax it to admin@optimalhealthadvocates.com. Our office fax number, 877-733-4887. And of course, you can always check out our website, which has a wealth of information, www.optimalhealthadvocates.com. Thank you for your time today, and we do look forward to working with you.